So it's now my great pleasure to introduce our plenary speaker, the keynote speaker for this morning's session. This is Mr. Ban Ki-moon. I have to say that I'm going to read out some aspects of Mr. Ban Ki-moon's bio, but he is internationally well known for his work, and I will not be able to do justice, but I would like to say this. Sir, you are one of my heroes, one of my international heroes for the work you have done. So, Mr. Ban Ki-moon served as President of the National Council on Climate and Air Quality. He served 2 terms to lead the United Nations. He gave voice to the world's poorest. He was of the most humanitarian of Secretary Generals of the United Nations. He did much of the work leading up to the Paris 2016 agreement on climate change. He has set a green agenda that the rest of us will benefit from for decades to come. He has contributed to nuclear disarmament and chaired one of the most important committees the world has ever had on nuclear disarmament. He has chaired many committees to reduce carbon emissions and to try and make the world a greener place. And he has been a voice for the world's poor and vulnerable for decades. We are completely privileged to have you here, sir. Could you please come and address us?
Thank you for your introduction. Thank you. Thank you for your kind introduction, Dr. Jeffrey Braithwaite, President of ISQua, and I'd like to thank Dr. Lee Wang-jun, President of ISQua, and Dr. Kang Jung-gu, President of HERA, and many distinguished participants and leaders of global health. Welcome to Korea. Good morning, everyone. Bonjour, buenos dias, ni hao, guten morgen, assalamu alaikum, namaste, dobre utro. Thank you. Welcome. 감사합니다. I used to greet the people who came to the United Nations to meet me at least one word, greetings, in their own words. But the 6 official languages, they are almost mandatory for me. But in addition to 6 official languages, I used to greet them in their own languages. I know that there are many more people from many different countries. Welcome to Korea in any way. 감사합니다. At the outset, I extend my warmest congratulations on the organization of the International Society for Quality in Healthcare ISQua 2023 conference here in Seoul. I'm honored to speak here at this conference on the timely and relevant topic of climate change and healthcare. Indeed, it is critical at the present juncture to elevate climate-resilient practices as we collectively strive to improve the quality and safety of healthcare in a rapidly changing world. My gratitude goes to ISQua, the Korean Society for Quality in Healthcare, ISQua, Health Insurance Review and Assessment Service, HERA, and the Korea Institute for Healthcare Accreditation, KOIHA, for your driving commitments for enhancing global healthcare. And my special appreciation goes to the distinguished ISQua 2023 participants, comprising over 1,200 delegates from more than 90 countries from all over the world. I salute you all and welcome again. Thank you. Now, more than ever, we require innovative leaders to advance multi-stakeholder partnership and cooperation in order to confront the great challenges we are facing, including taking climate action and persevering over pandemics. Ladies and gentlemen, we are living in an unprecedented era of new interconnected crises and elevated global uncertainty. Great power tensions are surging, and the illegal Russian war of aggression in Ukraine represents one of the most dangerous moments for global security in decades. COVID-19 caused extraordinary disruptions to our health systems, economies, and way of life for 3 years. At the same time, our planet is on fire, with the climate crisis deepening as the temperatures surge, floods rage, and wildfires burn. Global crises such as conflict, pandemics, and climate change have underlined our interconnectedness. No country is free from all these crises. They have also made it clear that we need inherently global solutions to address those global challenges. And such solutions must be rooted in partnership and innovation and centered on enhancing health, security, sustainability, and prosperity for all people everywhere. From cities to villages, from upper-income countries to the least developed countries, from communities plagued by war to those at peace, humanity is facing cascading, intertwined, and complex challenges that are impacting all human beings. Today, I will first speak about the great need to scale up public and planetary health by mitigating, adapting to climate change in a post-COVID-19 era, where pandemics are more likely to proliferate. And second, I will highlight the necessity of accelerating innovation, cooperation, and partnership in health to help achieve the United Nations Sustainable Development Goals. Distinguished guests, ladies and gentlemen, in today's era of global pandemic, COVID-19 and other viruses of duly elevated concern, such as monkeypox and Marburg, have brought the health and security implications of biodiversity loss into greater focus. As biodiversity and habitats are destroyed due to environmental damage, wild animals have increasingly come into closer contact with the humans, and as a result, more and more novel viruses and pandemics have spread. Indeed, nearly all of the viruses that have emerged in the 21st century, from SARS in 2003, Ebola in 2014, to COVID-19 today, share the characteristics of being common infectious diseases that have jumped between animals and humans. As such, climate crisis and pandemic are two sides of one coin, same coin, and inherently intertwined. The climate crisis is here and now. So we need elevated ambition, action, and political will to slash carbon emissions, implement the Paris Climate Change Agreement, and safeguard the future viability of both humanity and our planet. The global response remains critical, and therefore we must resist the temptation to backpedal towards fossil fuels and instead accelerate the green transition despite ongoing war in Ukraine and other crises in other places. This is particularly important following the mixed results of last November's UN COP27 climate conference in Egypt. We urgently need enhanced initiative and effort in the spheres of climate mitigation, adaptation, innovation, and finance to implement the UN global goals, limit temperature rise below 1.5 degrees Celsius, protect biodiversity, and save our planet. And every fraction of a degree matters immensely. Consider the fact that, according to the United Nations, at 1.5 degrees Celsius warming, 6% of the world's insects will lose over 50% of their habitat. However, at 2 degrees Celsius warming, a staggering 18% of all the insects will lose half of their habitat. And if current trends continue, more than half of the global's marine species may be all but extinct by 2100. This exemplifies the gravity of the extinction level events currently transpiring and elucidate the deep need for a universal paradigm shift that prioritizes sustainable co-living with nature, how to wisely live with nature, ecosystems, and other species will be a great issue for us at this time. In this connection, acting now to urgently fight climate change must be the overarching task of our lifetime. The Paris Climate Change Agreement, one of my proudest achievements leading the United Nations for 10 years, still provides our best hope to persevere over the dire climate threat to the Earth. We don't have a plan B because we do not have a planet B either. However, cuts in global greenhouse gas emissions are still far from where they need to be in order to safeguard a livable climate and thriving future for all. Indeed, recent UN climate report paint a worrying picture of fast approaching environmental tipping points and surging global heating if urgent climate action is not taken. In fact, my successor, current Secretary General of the United Nations, Antonio Guterres, he said, we've been saying that global warming, but global warming is over. Global boiling, he said, instead of warming, boiling. So we are living in that world. The UN Intergovernmental Panel on Climate Change, IPCC, very well-known organization, said that we have just 7 years to go to cut emissions by 50% in order to restrict the planet's temperature rise to 1.5 degrees before climate change becomes catastrophic. The bottom line is that climate change is precipitating insecurity, conflict, displacement, and grave public health risks all around the world. And it could get much worse. Under this complicated backdrop, in order to faithfully implement the Paris Climate Agreement and push it further, stakeholders must expand their ambitions and urgency to cut greenhouse gas emissions. Hitting net zero emissions must be the priority of our world. With this in mind, I believe that robust multilateral action underpinned by science, partnership, and cooperation must steer our responses forward. It is critical that we hit the net zero target by 2050. And to do so, we must turn existing international commitments into decisive action. Distinguished ladies and gentlemen, in addition to this, it is essential to interlink climate action to ongoing national and global COVID-19 recoveries and the UN's Sustainable Development Goals, as well as to empower innovation, partnership through quality and safe healthcare in order to realize the UN global goals. Indeed, holistically expanding innovative and inclusive public health efforts is critical for the future of our communities, our countries, our regions, and our world. Health is a fundamental human right and a key driver of sustainable development. Poor health can result in increased poverty, limit access to education, and stifle economic opportunities for individuals and communities. Thus, health is inherently connected to other sustainable development efforts, including peace and security, climate change, water and sanitation, and gender equality. One of my proud achievements as UN Secretary General was bringing the world together for the landmark 2030 Agenda for Sustainable Development Goals and its SDGs with 17 goals. I am always wearing this SDG mark, United Nations SDG mark. So please, if you can, and make people know about SDGs. It was adopted by 193 member states in 2015, September 2015. The SDG provide humanity and our planet with a collaborative blueprint to chart a new transformational path by delivering on issues such as poverty, public health, climate change, inequality, and gender equality. And among these goals, SDG number 3, ensure healthy lives and promote well-being for all at all age, calls for reducing premature mortality from non-communicable diseases through prevention and treatment by 1/3 by 2030. It also crucially targets ensuring access to safe, effective, equality, and affordable essential medicines and vaccines for all. So in a variety of ways, the significant work that you are all undertaking, both at this conference and daily in your varied work, directly contributes to the UN SDGs. But to further expand such efforts, it is important to continue to dynamically elevate and target our collective partnership efforts in the following 3 key areas. First, we must enhance expertise and knowledge sharing to accelerate action and leverage the unique and powerful role that quality healthcare can and must play to help achieve 2030 Agenda for SDGs by its target date. Over the next 7 years, progress in science, technology, and innovation will be essential in helping to deliver all of the UN SDGs, from public health, climate action, poverty eradicates, and food security to energy, water, and sanitation, and beyond. And I firmly believe that ISQua 2023 is taking place at a pivotal juncture for boosting collaboration and innovation in harnessing technology, culture, co-production towards the realization of the SDGs, carbon neutrality, and accelerated climate resilience adaptation. Indeed, digital technologies, robotics, artificial intelligence, AI, and automation, biotechnology, nanotechnology, and beyond all have fundamental and far-reaching impact, as well as present opportunities and challenges. They can measure and forecast carbon footprints, help eradicate poverty, bring high-quality education to all, and cures for intractable diseases, and expand mankind's knowledge base, improve resource efficiencies, offer carbon offsettings, etc. Interlinking science and technology with progress in public health, climate action, and sustainable development at the ground level will be greater challenge. Second, while the role of government will remain essential, I believe that sustainable financing of the advocacy of the health and economic benefits of such emerging technologies can accelerate widespread demand, adoption, and commercialization at a time when our planet and humanity needs them the most. Third, strong multi-stakeholder global partnership, where the United Nations and UN member states work alongside scientists, WHO, private sectors, health workers, civil society, and academia. There is not a single country in this world or individual who can take all these challenges, however one may be resourceful and rich. With this in mind, I commend the ISQua 23 Seoul Conference for connecting key global stakeholders across health, policy, technology, and society to advance the green transition from cooperation, catalyze the reach of quality and safe health care, mobilize dynamic new partnerships to help solve our world's greatest challenges. ISQua's prioritization of forward-thinking initiatives like today's workshop to develop a new ISQua green paper on high-quality, environmentally sustainable healthcare will surely go a long way towards this noble goal. Ladies and gentlemen, now more than ever, we must illuminate a new path to confront the great challenges we are facing. This is true in regards to ensuring sustainable development, realizing safe and quality health care, and taking climate action. And leaders like yourselves, the esteemed ISQua 23 Seoul Conference participants, are indispensable in such efforts. To do so, we need a cooperative partnership approach where everyone joins together to catalyze all healthcare and societal stakeholders to elevate sustainability, enhance climate action, and ensure greener prosperity. Ladies and gentlemen, let us collaborate across borders and seas. This will boost sustainability and guide collective action in an increasingly divided world. And I am confident that all of you who are present here today, you have a major role to play to advance sustainability, accelerate climate action, and enhance quality and safe health for all of the globe. With that, I'll conclude my remarks by reiterating my warmest congratulations on the successful organization of this ISQua 23 Seoul Conference. Thank you. I wish you all the best. Thank you very much.
Dr. Ban Ki-moon, thank you very much. Thank you indeed on behalf of the audience for your words of wisdom. Have you time for a short question?
Yes, yes.
Please. And may I invite Professor Sang-il Lee, please, to join us. Professor Sang-il Lee was the co-chair with me of the planning committee for the conference.
I see.
We're very grateful for you accepting our invitation. Thank you for those wonderful words and for your lifelong dedication to the world. So maybe on behalf of the audience, can I thank you once again? Perhaps there is a question that I was thinking as you were speaking. So where are you after a lifelong of work and that stirring speech, that call to arms for us to fight for the climate and for the world? Where are you on a scale of optimism or pessimism now?
There are many areas, many reasons I am pessimistic about what we are doing, what world leaders are doing. First in climate change and health issues. Now, we have suffered a lot. Let me talk about health. Why political leadership is very important. Let me talk about Ebola, difference between Ebola 2014 and COVID-19 2000 until 2023, up to now. There's a huge difference depending upon how you deal with this matter. I'm just a layman when it comes to medicines, health. I don't understand what you will say when you say in academic and scientific world. But I know that without the human being, without being healthy, you can do anything. You cannot do anything. So health comes to the first. So even though all this SDG was not numbered in terms of importance, but there is some reasonable ground. First, when a human being is born, one needs to have something to eat. And one should be elevated from this abject poverty. Then, number 3 goal of Sustainable Development Goal says that we should be healthy. So that's very mild, it's not hugely ambitious, saying that one should not die from preventable diseases. There are, I understand that many diseases which scientists have not been able to identify, to address. So at least one should not die from preventable diseases. It happened. It happened during the time of COVID-19. Then what I did as a Secretary General, I'm a layman, but when I was informed by Margaret Chan that WHO has a limitation in their capacity to handle this Ebola. Ebola, as you know very well, happened in a small town in Guinea, 2014. Then it spread rapidly to Liberia and Sierra Leone. By that time, we were alarmed. Margaret Chan alarmed. My health special advisor, maybe you know him, Dr. David Navarro, he was my special assistant for health, just working always in New York. He stayed permanent in New York from WHO. He advised me that we have to take urgent action. You have to report to the Security Council. So I did report to the Security Council. The Security Council at that time were rather more harmonious, not as like this today. Chinese Americans were talking harmoniously. Russians and Americans were talking harmoniously. They, according to my proposal, the Security Council adopted a resolution on a health issue, declaring that Ebola virus is a serious threat to the peace and security of the international community. That is a very powerful message. Then, following day, I went to General Assembly. I reported that this is a Security Council resolution, and I must take and implement all these things to prevent further spread of this. Then General Assembly adopted by consensus and accepted my proposal that we must establish an office, a special office, UN Ebola Emergency Response, UNMEER, UNMEER, United Nations Mission Ebola Emergency Response. Yeah. These are what UNMEER stands for. For the first time in the UN history, UN deployed military soldiers to cut off unnecessary travelings and trafficking between the people, between and among the people. President Obama dispatched 7,500 soldiers to Liberia. President Hollande, 400 soldiers to Guinea. And Prime Minister David Navarro, then Prime Minister of the United Kingdom, he sent 750 to Sierra Leone, soldiers. And I volunteered, together with the President of World Bank, Jim Yong Kim, who himself is a medical doctor. We went to 3 countries and Ghana, where UNMEER was headquartered. And we went to even Mali, not only Liberia, Guinea, Sierra Leone, because Mali was also on a very much delicate positions. So just to prevent. At that time, this hand washing and arms greeting by elbow came without shaking hand. That was what happened. By doing that, we eradicated this Ebola. About several hundred people died, all cases of 25,000 or so. Compare with COVID-19, when President Trump accused China that this is a Wuhan virus. Of course, it was a Wuhan virus, but Chinese were very much ashamed. The Asian people sometimes respect all this, respecting the people, whether you are, in a difficult position or something. Then when President Trump attacked the President Xi Jinping like a Wuhan virus, then Chinese people were very much ashamed. Then they did not collaborate with WHO. That's why this disease has become spreading all throughout the country. The end result, almost 7 million people died in 3 years, and almost 770 million cases now. Then what was much, much worse is the Security Council was not able to take action. Chinese delegation was very angry, and they would not recognize that it was a China virus. I know that there should be some from China here, but I'm not accusing China. The Security Council, after almost 40 days, they were forced to take resolution that this virus is a serious threat to international peace and security. Then look at the difference between Ebola and COVID. With just 40 days of delaying action, global action, then we lost the vitally important timing to cure this COVID-19. That's why this has become one of the biggest, the worst cases since 1919, when this world was hit by this COVID. At that time, I forgot the name of the disease. Yeah. In any way, we learned the hard lessons. We must not repeat the same mistake. One may be excused for first mistake, but one will never be mistake to repeat the same mistake for second time. So this is hard lesson. Thank you.
Thank you. That was... Thank you. We must learn from the good lessons of history. Sang-il, shall we allow Ban Ki-moon to depart now? He has another engagement.
Thank you.
Thank you.
I have to go to the airport now.
Thank you.
Thank you. Thank you very much.
Thank you very much.
Thank you. Thank you. 자, 감사합니다.